Hi folks, I'm Dr. Michael Jones, President of the Medical Exercise Training Institute, and I'm here for our last video discussing medical exercise training, the new modality. Now at this point, we've talked about the role of the medical exercise specialist, we've talked about the huge impact chronic medical conditions have on the healthcare system. We've talked about medical exercise training and what it is, but now let's talk about the delivery of those services. Our average medical exercise training client, and this is from 25 years, offering the certification of medical exercise specialists around the world. We find now the average medical exercise training client is anywhere from 25 to 80 years of age. This individual has a medically stable chronic condition ranging from obesity to a total joint replacement. This individual has a referral from their physician or medical professional for medical exercise training, which means they've already gone through physical therapy, chiropractic, or nursing care, whatever the case is. At this point, they're now medically stable and they're able to start an exercise program. So again, medical exercise training doesn't in any way try to provide the same services or compete for individuals that need physical therapy, chiropractic, and or medical care. These clients normally come in 2 to 3 times a week over a period of 8 to 12 weeks, and each session consists of some aspect of strength, cardiovascular, stability, balance, and flexibility training. All of this is done with the idea, let's improve the client's level of function after they've been discharged from physical therapy, chiropractic, and medical care. Our MESs are taught to identify the residual functional deficits that are left over after medical care is done. And folks, nowadays with the changes in healthcare reimbursement, we're seeing those deficits are getting much and much larger. So this medical exercise training process is a very step-by-step approach, and this is what every medical exercise specialist is taught. Each one completes a thorough medical history on the client to make sure they truly understand what's going on with the client. Along with that, they complete a musculoskeletal screening to make sure the client is appropriate for exercise, and if not, they identify red flags. That individual will sit back to their doctor, therapist, or chiropractor for further consultation or medical care. They also complete a regional medical MedFit assessment that allows them to get an idea of the residual functional deficits that are left over, and also allows them to dig a little bit deeper and find out specifically what problems the client has, and again, if they're appropriate for exercise or they need more medical care. There actually is a summary of the program that is communicated to the referral source, so the doctor, therapist, or chiropractor knows exactly what's going on. This is critically important because as fitness professionals in the fitness industry, in the past, we haven't done a good job as far as communicating effectively with the medical community, which is vitally important. A progress report is forwarded to the referral source every 30 days or whenever the client has a follow-up visit. And the MET session is documented in the client's file, so we have a clear understanding of what was done with the client in case there are any disputes down the road. And all of this is based on the idea of improvement in functional outcome measures. Now, folks, this step-by-step approach is vital for those of you out there that are looking for a medical exercise professional to work with you or a loved one. For medical professionals that are looking to now collaborate with fitness professionals, they must be able to do this. And for those of you out there that want to bridge that gap between healthcare and fitness by providing medical exercise training services, get the proper training so you can do this, because this is vitally important along the way. Now, there are a number of medical exercise training options that we've seen developed over the last 25 years. Probably the one that's most often seen is one-on-one medical exercise training sessions. This is probably the one where we can see the most effective utilization of exercise to produce positive outcomes. But for some individuals that are economically challenged, small group training is available as long as the individuals in the group have similar medical conditions. And we also find now that MedFit training classes, which involves both education and exercise combined in a class, has probably the best outcomes that we see, because we realize it's a component of not only exercise but also lifestyle management that has a huge impact on the outcomes. So we're finding now these MedFit group training or training classes have a huge impact on the client's overall outcome and long-term outcome, and we're finding the medical community really likes these, the clients really like this concept, and we're even finding now insurance carriers like these concepts. Again, if you want to get more information on becoming a certified medical exercise professional, please contact us at the medicalexercisetraininginstitute.com. Now, let me say this. We know that medical exercise training will increase in its need exponentially over the next 20 years. The reason? People like myself, the baby boomers. We're now getting to retirement age. We've got arthritic hips and knees that need to be replaced. We've got back injuries. We have hypertension and diabetes. And we want to do the same things in our 60s and 70s that we did in our 50s and 40s. We go to the physical therapist, we get 5 or 6 visits, and then we're done. Now we're looking for something else to do, but because we're a little bit more active than the last generation, we realize the importance of the health club. And we go to the health club, but we find an individual there that isn't well versed in our condition, doesn't understand some of the common terminology, and we're reluctant about having them communicate with our physician, but even more so the physician, therapist, and chiropractor is reluctant about communicating with this fitness individual, because when they do have that initial conversation, there's a huge abyss, there's a huge gap there. And that gap is getting bigger and bigger. And folks, that gap getting bigger and bigger means there will be more wasted billions in trying to manage medical conditions that are chronic. So please, if you're interested, come over to medicalexercisetraininginstitute.com to get more information. And again, folks, this area of medical exercise training will grow exponentially over the next 2 decades. Please join us and help us bridge the gap between healthcare and fitness. Thanks again for watching. All the best to you.